This is a day of those that we feel need a response, not people just getting in touch.
Charles Walker's public call for people to write to him if their mental health is suffering through lockdown has brought a deluge of post.
I've had thousands and thousands of emails. People worried about their children who were self-harming, anorexia, people worrying about their husbands who were crying a lot, people worrying about their wives who are struggling, people worrying about eating disorders, people worrying about whether they can continue. At the extremist, people telling me about those of their family that have taken their own life because they couldn't really cope any longer.
His constituent April Howes was one that wrote she worries her son is losing hope and withdrawing.
He worked in a bar, he was a cocktail waiter, he socialised with people, that's,
And now he's staying in his room?
Yes, yeah, that's never been him. He's always been out and about, and now he's, hard to reach.
I've heard from a lot of psychiatrists, psychotherapists, psychologists, I'm sure it's not universal, they're a self-selecting bunch, they're writing to me, who are already overwhelmed with the call on their services, with really ill people, people having to be sectioned, people having breakdowns, and they're already overwhelmed, and they say this is just the beginning.
I hope that there isn't that much longer to go now, but clearly people have been under a lot of pressure, and we've got to address that.
I think we need more people around the table thinking about this. We need more compassionate voices. I think he needs to be better briefed about the mental health consequences. Right now he's briefed by virologists and epidemiologists.
Charles Walker says some local schools are reporting the COVID lockdown is bringing some households to crisis point, which makes the schools expect mental health issues amongst returning pupils.
As a result of lockdown one, we feel that 40% increase in our child protection referrals have been made in comparable months between this year and in the previous year.
And the impact on the children?
The impact on the children can be very significant in those kind of cases. So there can be anxieties, there can be issues of self-esteem, but they can move into problems with eating disorders, sleeping problems, and of course the higher end with self-harm.
At another constituency school in contact with Charles Walker, they worry there'll be no quick fix for those whose mental health has suffered during the lockdown, even if schools reopen soon and for good.
What would normally be going on here?
It'd be textiles, learn a lot about different fabrics.
Because there might be people out there who think, sure, people have been through an anxious time and they might have been in a very anxious household where the salary's not coming in, the rest of it. But when they get back into school, they're young, they'll ping back into shape.
Should we come back in March? That's not the end of it. It's probably just the start of it. It's going to take time. It's not going to take weeks, it's probably going to take months or years to actually work its way through the system and for us to be able to reach the hard-to-reach young people properly.
Charles Walker has voted against all 3 national lockdowns, even though parts of Hertfordshire have recorded particularly high COVID infection rates.
You know the argument from the government, which is that if they hadn't done this lockdown the way they've done it, the NHS would have toppled. There would have been more anxiety, perhaps, more grief.
Maybe all this was necessary. But as I've indicated, I don't think anybody thought it through. I don't think anybody thought through the consequences. And these lives will be lost, lives ruined, and all of these are tragedies. And yeah, many people will get through this. Many people will sail through this, yeah? But lots won't.
8 years ago, Charles Walker spoke in the House of Commons of his own mental health issues.
Some of your colleagues on the Tory benches might mutter, "Oh, it's Charles. He's lost it."
They're probably right. It's almost like catch-22. If this didn't send you slightly doolally, there would be something wrong with you, wouldn't there? So they're probably right. I'm not really worried.
Charles Walker believes mental health has been an afterthought in this crisis and that we will now have to act fast to limit the hidden harm it has done to so many.
Well, there's a growing debate about whether the current system for deciding who gets vaccinated is ignoring some of the most vulnerable people in society. The crime writer Ian Rankin's son Kit suffers from Angelman syndrome, which means he needs continuous care in a home. Ian Rankin has had limited contact with 26-year-old Kit since the lockdown began and has become increasingly frustrated that his son is still waiting for his first jab, which could allow them to meet up properly again. Now the charity MENCAP is calling on the government to make all people with a learning disability a priority for vaccination. I spoke to Ian Rankin earlier and asked whether he thought the priority list for vaccines has been wrongly structured.
I would have thought so. I would have thought that he was a vulnerable adult, like many of the people in the facility that he lives in full time. They're in and out of hospital all the time. They have lots of issues, lots of health issues. I mean, Kit himself suffered from epilepsy in his younger years, and I don't know if a case of COVID would bring that back again. And so I can't quite understand why they've been left so late in people's thinking. I mean, I'm guessing the science told the governments that this was the way it needed to be, but I would like to see some evidence. I would like to see the evidence they were working from, because charities like MENCAP are telling us that people with learning disabilities are 5 or 6 times more likely to die of COVID if they catch it than the general population. And for young adults with learning disabilities, it's something like 30 times more likely to die. So if my son were to get COVID, he would get it hard, he would get it bad. And of course, we wouldn't be able to visit him in hospital or anything else. He would be surrounded by strangers, not knowing what the heck is going on.
There are lots of people in very individual circumstances who feel that they are not getting, or their relatives are not getting, the vaccine in the right order. And the trouble is you're up against a wall of officialdom that says a committee of eminent scientists has considered all of this, and this is their answer. So what do you say to that?
Oh, we've had no information. I mean, we visit our son once a week. We see him through a gate or over a wall. He comes out into the garden of his facility. And then we talk to the carers, and that's our contact point. We've had no contact to say, look, this is the group your son is in. This is why he's in that group. And the care home staff themselves haven't been told. I mean, they were classified as a care home for lockdown purposes. So they locked down very hard, but they're not classified as a care home when it comes to people getting the vaccine. And that just seems to me to be a lack of joined up thinking and people making it up as they go along, or the sense that the UK as a whole has been making it up as they go along.
And what's been your perspective when a lot of the people opposing lockdown measures have been saying, well, the people who are vulnerable are just the old and the disabled? What has that told you about our society's attitudes?
Well, we all like to think we're living in a progressive society, and I mean, a progressive society looks after its weakest and least able to look after themselves. The staff at Kit's facility have been absolutely amazing. They keep us in regular contact. They send photographs and video clips, but he's had none of the therapies you would normally get in a year. He's not been able to. He's only been outside the facility once, which was he was allowed home Christmas Eve. So we went and got him and brought him out for one day. His life has been rendered, less full, less rich because of all of this. And as soon as we can, I just want to take him for a walk. I just want to put him in his wheelchair and take him out for a walk.
And who is it you hold or want to hold accountable for this? Is it Nicola Sturgeon or the JCVI, or who is it?
It's impossible to say. I mean, I'm sure if you complain to the politicians will point you to the scientists. I just hope we can learn from this, learn that in future, if something like this happens again, we maybe do think about prioritising people who are most vulnerable. I think that's it. We need to classify people with learning disabilities as being amongst the most vulnerable and not be forgotten about until the bitter end of the vaccination process.
Ian Rankin, thank you very much.